in the cell, and I will be doing my 2 medication checks. I will be dispensing and preparing the medication. I will compare my prescription to my original prescription order. I have already done my calculations that I needed to do and looked over my reference book for each of my medications, and I have looked over the adverse effects and symptoms that they need to report. So now I will begin to dispense my medication. So my first medication is diazepam. I will compare it to my MAR and verify that I have the right client, medication, dose, route, and time, and checking for any expiration dates. My second is ceftazidime, and this is ceftazidime. And I will be comparing it to the MAR and verifying for the client, medication, dose, route, time, and any expiration dates. Everything looks good. Next one is my insulin, comparing it to the MAR and verifying for the right client, medication, dose, route, time, and the expiration dates. And I have my purified protein derivative, and I will be comparing it to the MAR, and I'm verifying for the client, medication, dose, route, time, and the expiration date. And my last one is citalopram, and I will be comparing it to the MAR and verifying my 5 rights of medication. So that is my first check. Now I'm gonna begin to do my second check, which is preparing my medication. I will wash my hands, put on gloves, first one that I will be preparing is my citalopram, which is the tablet, and the order is 20 milligrams, but I need to administer 10 milligrams, so I will cut my medication. Before I do that, I will clean my med cutter or pill cutter. Make sure it's clean before you cut it. Garbage. Let that dry a little bit. That didn't go on like that. Okay. So I'm using half, and then I'll dispose this one appropriately, and I would re-clean it for the next use. And so I will verify or compare it to the MAR one more time and verify the right client, medication, dose, route, time, and the expiration dates. The second one is diazepam, and I will compare it to the MAR and verify my 5 rights. Dispose of in the Sharps container. So I need 1 ml. I'll get past 1 ml to make sure I get the correct dose. Getting rid of any air bubbles. That is 1 ml.
For whatever reason, can't. Oh, there we go. Couldn't get the focus. Okay.
So I will recap doing the scoop method. Dispose of sharps container. I will change this one to 25 gauge and 1 inch needle. I will label it to have it ready to administer. Next, and I will discard of my filter needle as well. Now I will be preparing my purified protein derivative, and I will compare it to the MAR, and once more I will verify the right client, medication, dose, route, and time, and for any expiration dates. For this one I will need 0.1 mils, and we'll be using a 1 ml syringe. Oh, before I do that, I will clean my vial. For 20 seconds. Okay, now I will do that. Draw 0.1 of air. Now get past 0.1 just to make sure once again that I have the correct dose. Get rid of any air bubbles. Oh. I'm just gonna restart that one.
Okay.
My needle tried coming off. All right, 0.1.
Okay, good.
A little air bubble. Okay. And I will have this one labeled as well and have ready to administer. So the next medication I'll be preparing is ceftaroline, and I will be once more comparing it to the MAR and verifying the 5 rights of medication administration. So I'll cap my vials. Make sure I clean each vial for 20 seconds. I will use a 3 ml syringe and my filter needle. So I need to draw up 2.5 mils of water, so I'll just get a little bit of air. Of sterile water, I meant to say. Get past 2.5. Make sure get the right amount. This is 2.5. Stir water.
Okay.
And I will put into my reconstitution powder. Slowly. Scoop method. Dispose of in the sharps container. Put a 25 gauge needle with the 1-inch size. And I will now mix till dissolved. And I need to administer 1.2 mils. I believe I have already cleaned my vials. I plan to administer the medication intramuscularly, as well as my diazepam, but I would do these once I enter the room. Get past 1.2 mils. Okay, 1.2.
Okay.
Scoop method. Have this one labeled as well. Garbage. And last that I need to do my second check for is my insulin medication. And I'll be comparing it to my MAR. And once more, I'll be verifying the client, medication, dosage, route, time, and the expiration date. Clean my vials. If I sold my gloves, I would have changed them. 20 seconds each. So now, before I do anything else, I will make sure to mix my NPH. Make sure it's dissolved. I will grasp 5 units of air, put that into my NPH, and then I'll do 30 units of air, put that into my regular insulin, regular insulin. Okay. 5 more and pH. So I'll get a total of 35 units. That is the amount I'll be administering, and I'll have my second nurse verify. That is 35.
Oh, there we go.
I'll have this one labeled as well. Ready to administer. Oh, and then I believe I already verified my pram. So I will have my I'll have a second nurse be with me to supervise me or watch me dispose of these medications appropriately. I will now remove my gloves, wash my hands. Now that I have them ready to go, I will go into the room. Hello, closing the door for privacy. My name is America. I will be your nurse today. I'm gonna wash my hands. Can I have you please verify your name and date of birth? Okay, and I will be scanning your barcode compared to my MAR. Okay. So today what we're going to be doing is administering your daily medications. I will need to take your vitals and your glucose level because these are going to be my baseline vitals before I administer your medication. So I will take your blood pressure, respiratory, pulse, oxygen, temperature. Those 5 vitals that I need. And then, are you in any pain today? None? And any allergies? None? Okay. So I will now document those vitals before I begin. And I checked your glucose level, and it looks like that we do need to administer your insulin. So now I'm gonna begin to administer your medications. So the first one is your diazepam. I am gonna put on gloves before I administer your meds. So your diazepam is for your anxiety, and the onset is 20 minutes. I will be administering this one intramuscularly in your deltoid muscle. So this one is going to be so 2 fingers from your acromion bone and a hand from your elbow. So I will be doing it right here. I am inspecting for any wounds, lesions, scars, blanching, and none of that is apparent. Client has stated for me to expose him. Okay, so, and for this one, I will inject it slowly. Some adverse effects to look out for is drowsiness, dizziness, and constipation. If you are in the need to get up or do something, please let me know so I can help you with that. And symptoms to report are slurred speech, slow heart rate, and slow breathing. Okay. So now I will disinfect the skin, going in and out, outer motion for 20 seconds. I will administer it at a 90-degree angle. Oh, and sorry, before I administer it, I'm gonna do my third check. So I will be comparing it to my MAR, and I'll be verifying it for the right client, medication dose, route, and time, and checking for any expiration dates. And everything looks ready to go and is correct. So now I will, since I already wiped your skin, I'll pull the skin taunt and insert it at a 90-degree angle, a dart-like motion. Inject slowly, and I'll leave it in there for 10 seconds. Withdraw it the same way, 90 degrees. Good method. I'll dispose of it in my sharps container. Okay, use a little stop minimal bleeding. Okay, so the next one is your cefazodime, is your antibiotic to treat your bacterial infection, and this one will take an hour to give effect. This one will be intramuscular as well, and I'll do this in your vastus lateralis. I will also now be doing my third check. So I'll compare this to my MAR and verify for the right client, medication, dose, route, time, any expiration dates. Okay. So now I will begin to inspect the site of the injection. So this one is hand from your shoulder planter, and your knees. So, and I will do it laterally right here.
Okay.
Sorry, doing the Z-track method.
Okay. Let me get a good angle. Okay.
Okay.
Good.
Before I begin, I will tell you a little bit more about this medication. So I will inject it slowly. Adverse effects to look out for are pain and swelling from the injection site, and report any anaphylaxis shock or dyspnea or erythema. Those are symptoms to look out for. So now I will clean the skin, going in and out, 20 seconds. This one, I will administer it at a 90-degree angle as well, and doing a dart-like motion, and pull the skin taut. Inject slowly. Leave in there for 10 seconds. Withdraw the same 90-degree angle. Dispose in my sharps container. And now I will administer your insulin. And I have already checked your glucose level in the beginning of when I first came in. So your insulin is to control your sugar levels, and I will be administering this one subcutaneously, 2 inches from your umbilicus, and I will inject it slowly. I will rotate sides, so I have done it last time in your right side, so I'll be doing it on your left now. And adverse effects to look out for: pain, redness, or itching of the site. Symptoms to report are anaphylaxis shock or hypoglycemia. So now I will begin to, before I do that, I will do my third check. I will compare it to my MAR, verify for the right client, medication, dose, route, time, and expiration date. Everything is ready to go. So now I will begin to inspect. So 2 inches from the umbilicus. So be right here. And I am also inspecting for redness, swelling, or wounds. Blanching. Everything looks normal, nothing, no signs of redness, swelling. So now I will begin to clean the injection site. Pouring it in and out motion for 20 seconds. For this one, I will administer it at a 90-degree angle as well. And pull 2 inches of the skin. And as I mentioned, this one is subcutaneously, so I'll be doing it where there's a lot of fat. Inject slowly. And I'll leave it in there for 10 seconds. Make sure the medication is in there. And this one will take about a 30-minute effect. Dispose of this in my sharps container as well. And use gauze to stop the minimal bleeding. So the next one is the TB test, and I will first compare it to my MAR. I am verifying for the red client, medication, dose, route, and time, and any expiration dates. And this one is going to be an intradermal site, so I will be administering it in your inner forearm. So 2 fingers, a hand from your elbow and your hand, so inner forearm, right here. And I'm inspecting for any wounds, lesions, scars, or redness or swelling. I know that is apparent. I will now.
Doing it just in this one? Okay. Are you doing it in this one?
Yeah.
Okay.
So for this one, it will take, we'll need you to come back 48 to 72 hours to check if it was positive or negative. An adverse effect is just minimal bleeding. Any symptoms to report are swelling or inflammation, difficulty breathing. So now, and I just wanted to let you know, I should have told you this in the beginning of our, when I first came in, I should have told you that you do have the right to refuse any of the medication. Now I will begin to clean your skin, going in, out for 20 seconds. And this one I will be administering at a 15-degree angle with my valve up, facing up. And I will be looking for a belt. So pull the skin taut. Okay, scoop method, expose. So now, I will be administering your escitalopram, which is for your depression, so it's an antidepressant, and this one takes about a week to give effect. I will now do my third check, so I will be comparing it to my MAR. verifying for the right client, medication, dose, route, time, and for the expiration date. I have my water, and some adverse effects to look out for are nausea, dizziness, constipation, and report any symptoms of anaphylaxis, shock, or seizures or fever. So this one is by mouth. So are you able to administer this on your own? Yes. Okay. And I will make sure to stay by my client's bedside until he has fully taken his medication. And I already had him sitting up, so I would have him sit up when he takes oral medication. I will now document the time I administer the medication and initial the date and time. So I will now remove my gloves, wash my hands, and before I head out, I just wanted to evaluate the medications. Your diazepam, that one was going to be a 20-minute effect. So has that, your anxiety pill, has it made you feel better? Do you feel more calm? Yes, okay. I will document that. And for your cefazodine, your antibiotic, that one won't, like I mentioned, that one's an hour to give effect. So I will come back in 15 minutes or in an hour to reevaluate if the medication is working. And your insulin, that one was going to be 30 minutes. I will check your glucose levels and document if it's gotten better. And as I mentioned, your TB test, that one I will need you to come back 48 to 72 hours to check if you are positive or negative. And your citalopram, that one is your antidepressant, so that one won't take effect in a week. So we'll have you come back in a week and we'll reassess if this medication is working for you. So that is all. Here's your call light. I'll gather my equipment, wash my hands, leave the room, close the door.